I was making rice and sausage,
Nice.
but the sausage refused to cook, so
That's on sausage then.
go leave.
That's on sausage. Okay, rest everybody ate. Tell me who didn't eat. Me. I feel like in coffee machine it takes time. I was literally making my coffee the entire time. Anyway,
Spend time.
yeah. I think after this class I'm gonna have my food. Alrighty,
And then
everybody.
class. And then
Sorry?
start the class.
Yes, exactly. Let's start the new class. Oh, God. Alright. Now, let's see hierarchy of control. We have done hierarchy of control, but we have done it in a different segment, which shows different. Okay, so let me show you one quick video on this. Hierarchy of controls of health and safety. Okay, everybody. I want to show you interesting one. Alright. Okay. Everybody, but please do pay attention, because hierarchy of control is one of the important topics throughout the whole unit. Okay? Okay, everybody? You keep on nodding your head, but I can't hear you guys.
Okay.
You had food, I didn't have food, so at least say yes. Okay,
Yeah.
are you able to see the screen though? Are you able to see a doctor on the screen?
Yes.
Yes.
Are you able? Good. Audio?
To manage the risk of
Yes.
Perfect. I'll stop my video, otherwise it'll keep on showing myself. The audio of this video is very low, so concentrate.
To manage the risk of COVID-19 in the healthcare workplace, we need to look at how the infection spreads and how to reduce exposure. We know that COVID-19 is mostly spread by droplets and aerosols, which are breathed, coughed, or sneezed out and can directly enter another person's mucous membranes, such as the eyes, nose, or mouth, allowing it to enter the body. This is known as direct spread, and it's most likely to happen when people are close together. It can also spread indirectly when infected droplets find their way onto surfaces. For example, if an infected person blows their nose, then touches something such as a door handle, someone else could become infected if they touch it, then touch their eyes, nose, or mouth. The chances of spreading COVID-19 increases if people are closer to each other and if they spend more time with an infected person in their environment. To reduce the risk of spreading COVID-19, we need to apply a set of control measures. These are known as the hierarchy of controls: elimination, substitution, engineering controls, administrative controls, and PPE. This is an important framework for all of us as employers, managers, and staff to use together when assessing and managing risks associated with any hazard in the workplace. The controls in the hierarchy should be considered in this order, as they have more effect on reducing the risk from the hazard. The most effective controls involve getting rid of or eliminating the hazard where possible. It is extremely important that staff are vaccinated, but we must also continue to take further preventative actions to eliminate or reduce the risk of exposure. We can use video or phone calls for meetings with patients or colleagues instead of meeting face-to-face. We can use COVID testing and symptom screening to identify patients and staff who are infected with the virus. Then, depending on what the result of the test is, we can segregate patients according to whether they currently have the infection or not. It's really important that the rules for taking COVID tests and acting on the results are followed to prevent infection being spread in the healthcare setting. Where possible, based on local clinical judgment, we can temporarily postpone treatment of a patient until they are no longer infectious, so that others are not unnecessarily exposed to the virus. Substitution means switching a process or practice so that you can try to avoid a hazard, such as cycling to work instead of car sharing with a colleague you don't live with. Engineering controls work by removing or containing the hazard. We can make changes to the care environment to reduce the spread of COVID. An important example is increasing airflow in areas where patients with COVID are, such as increasing the turnover of air delivered by the ventilation system, or opening doors and windows to increase air circulation. Another example is using barriers or screens to prevent spread between people who are close to each other. Administrative controls involve changing the way people work. The virus is most likely to spread when people are close to each other, so changing the way that staff work together can help to avoid extended periods of close contact. For example, don't mix at the central station or in offices. Provide areas where socially distanced breaks can be taken, or hold remote meetings and access data digitally. However, when delivering care, it's not always possible to keep 2 meters apart, in which case PPE is required. PPE is the last level of control in the hierarchy. When care involves close contact with a patient who has COVID, PPE provides an additional barrier, for example by protecting the eyes, nose and mouth. For PPE to be effective, we must wear it correctly. For example, mask, eye and face protection must be fitted properly over the eyes, nose or mouth. We must also avoid spreading infection to others. You can easily spread bacteria and viruses on your gloves, so it's important to take them off after each task and to clean your hands. Although PPE can be uncomfortable, you need to ensure that you are wearing it properly, that you get rid of it safely, and you must always wash your hands after doing so. Even if you have had COVID or have been vaccinated, you are not 100% protected against getting it again, and you could still spread the virus to others. So it's still important to wear the correct PPE and follow the other control measures. Encourage patients to wear a face covering or face mask if they're able to do so, as this will help reduce spread to other patients and staff. By working together to apply the hierarchy of controls and follow policies and procedures, we can make the care and work environment safer and reduce the risk of COVID infection for patients and those caring for them. Every action counts. By following these control measures at all times, we will help to reduce the spread of COVID, helping to keep our patients and colleagues safe.
Okay, understood?
Yes.
Very simple.
Yeah.
Hierarchy of control. Good. Elimination, then isolation or engineering control, administrative, and then PPE. All good, everybody? Any questions on identifying control measures? Anyone? Okay. Next. Again, national standards and guidelines. We can see our national standards and guidelines on work health and safety legislation, and also on Australian guidelines of prevention and control of infection in healthcare. Alright, you can go into these websites and have a look what sort of prevention techniques they have given us. Now, communicate information relevant to risk management. Now, look at the step-by-step approach, everybody. First, establish the context? Okay, let me give you an example, then I'll explain it with an example. Risk management. So imagine there is a water on the floor and there is an old person with a stick on his hand. So this is a context. We have established a context, right? Now avoid risk. What are the risks here? Everybody?
Risk for falling down.
Yeah, the risk of falling. And what else is a risk? Water. Water can act as a risk. So now you have identified the risk that the person can fall down and there is water on the floor. Not only him, anybody who is going through that path can fall down because of water. Now you have analyzed that risk as well, that you know anybody could fall down. Then evaluate the risk. Now you have to evaluate that. We need to make sure if there is water, we need to put a caution board on it. Everybody has seen a caution board. You might have seen that in the mall, in a shopping center, right?
Wet floor.
Right? Come again, Audrey?
Is that the wet floor sign?
Yes, the wet floor sign, caution board. Right? There is wet floor. You can put that and then you can ask someone, a cleaner to clean it, or you can clean it yourself. Okay, now you have evaluated the risk. This is how we do risk management. Alright, everybody? Very simple. Nothing complicated. Now we're going to talk about the type of information that we communicate. We communicate through reports. Now reports can be verbal and non-verbal as well. Instructions. Instructions are mostly verbal, but they can also be written. It can be written in emails, it can be written on the template, it can be communicated in a meeting. Alright? Now, who will communicate these? If anything somebody wanted to communicate, who's gonna be involved? A supervisor, a GP, a healthcare professional, a carer, any responsible person in the team, any responsible authoritative person. Understood? Now, policies and procedures, everybody. Now, please understand that policies and procedures, any policies and procedure to any action which is required to remove any risk associated with any hazard, that risk should be taken an immediate action, like the water incident we just talked about. That is a hazardous risk. Anybody could fall, anybody could get injured. There should be an immediate action taken towards resolving that issue. Okay, guys, give me 2 minutes. I think I have somebody outside. Okay, just give me 1 second. Sorry, guys. Please read it. days I've received a parcel from my parents. Happy days. I can't wait to open it.
The food?
No, my parents live in the UK. They've sent me something. I know what it is, but I'm still excited to open it. It's Christmas. We are supposed to get gifts, isn't it? Okay, perfect. Oh my god, my heartbeat. Anyway, moving on. If there is any hazard in the facility or wherever you work, you need to immediately tell your supervisor about it. I think you might have read. And you also must document all the hazards. Now, everybody, have you ever done any hazard report form before in class or in any assessment?
No.
No? Okay. I will give that report form to our admin team. They will email you.
Thank you.
Okay? I want you to have a look at the hazard. You just have to explain what happened, basically. So I'll give that form and they will send it to you so you can have a look. All right? Or there's a chat box, right? Okay. We can be smarter. We don't need their help. I will show you a video while I need this laptop to get that hazard form. Okay, everybody, for the time being, just wait for me. I'll send you the hazard form. Okay, just wait here. Everything should be done quickly. Incident. Yeah, found it. I used to give this to my old students from another organization. So if it has some components on it, so just ignore it, okay? Just let me find it. First, let me share an PDF with you, which will give you an idea of like what can you report, like reporting time frames and everything. It'll give you an idea about that. Let me share that with you first, everybody. Chat box. Okay, everyone, I have just sent a reportable instances. Just let me know when you receive it, okay? It should be on your chat box now.
Got it.
Got it? Perfect. Rest, I'm gonna give you another. I will also send you some online learnings which you could do on your free time, okay?
Yeah.
Because it's very important to get connected to that aged care aspect of it. Where is it? There's some online learning aspects as well. Are you guys okay, tell me one thing. Are you all like permanent residents in Australia? Like
Not yet.
not yet? Like okay, when you will get your permanent residency, right? I'm writing it down here. There is a course about dementia in Tasmania University. It's an online course. Okay? It's free for residents. So whenever you get a chance, it's a free course, and I'm telling you, I've done it myself, and I've learned so many things about dementia that you can't even imagine. It's just so profound. The lecturers are so good that they make you understand dementia like anything. So that's why I think from learning from there, my love for dementia and dementia perspective have changed, and I work closely with Dementia Australia in WA, so I understand how important it is. So do that course, it's free for native people. But just double check, guys. I'm not too sure if you can do it or not. I think you might be able to do it if you have to pay few dollars here and there. But just double check, okay? Just don't get on my word that it's not free for you. But just double check. Incident report form. I haven't sent you an incident report form, right?
No.
No? Okay. Alright. This. What if I send you a website? Oh, there you go. This is the website. Erlin, yes, this is Erlin. That course is online. I've sent a link to incident report forms, guys. Can you check?
Yep. Go on then.
Found it?
Yeah.
I'll send you one Word form as well. Incident report. Do you want a Word or PDF? Tell me.
Video.
PDF? You won't be able to write on it. Why do you need a PDF?
Oh, can write on it with an iPad.
I need your Word, okay? I'm sending you a Word form. It is about incident report. Did you get it?
Yeah.
Now see, I've sent you 2 of the forms now. You see how different that is? And the second one that I've sent you is the sensitive biological agent regulatory scheme. They are the ones which you can send directly to the government. So don't use that anywhere unless you want to get in a big trouble. Alright, but it's my duty to send you different reportable forms. Then we also have incident manual questionnaire as well. Wait guys, there was a form in my computer that will give you a good insight. I'm not able to find it. But the link, you've got the link, right? I've sent a link of myway.org. Have you got that?
Yeah.
Have you opened it? Did you guys?
Yeah.
Do you get an idea? This is what a report form will look like. Most probably, everybody is going to use that same exact template. So it just gives you an idea when you have to do a report form, what are you going to write? Okay? Any questions? Anyone?
No.
Huh?
No, all good.
All good? Alright. Good. Good idea about incident reports? I want everybody to answer.
Yes.
Yes.
If you don't understand, let me know. We can do a report later this afternoon. So you get an idea how to fill this out. But I think it's very straightforward. You have to write where the incident has happened, how it has happened, and how is the person now, and who was involved and everything. Okay? Let's move back to the unit. Now, when we are communicating with others, we should communicate effectively, and we should do active listening. We should make sure when we should listen attentively, speak clearly, and ask effective questions. Alright? Now document risk and risk management strategies. You should always document risk. So I've given you an incident report. that can also be regarded as a documentation where you can identify risk. Okay? Now, there are some ideas for recording detective infection risk. Check if existing documents have taken notes of infection risk before. You should always double check that if there is an infection risk form, and then use appropriate form when updating or starting record of identify risk. Make sure you are using the correct form. Make sure that all information that you are recording should be correct and nothing should be false when you are completing that information. Because you need to understand aged care isn't a small, it's not a small designated term now, or it's not a small thing anymore. It's widely spread. Everybody is aware about it. So if you are going to give any false information, that is going to come back at you. Let me give you an example. At my other work, I had one incident recently, literally 2-3 days ago. I had a student who was going on work placement. Now that student reported an incident while they were on a work placement. Firstly, yes, you can give any incident reports, but you have to be very careful. Firstly, you are very new to the work. Second, you're doing your practical activities there. So you're not an employee. You're just a volunteering person who is learning how to do things. You should try to stay out of it. Now, what our student did, they went there and they saw something and they interpreted it wrongly. We all are different. We all interpret information differently. Correct? If I'll ask you all a question, right, you all are going to say different answers because you interpret information differently. And that's how we humans are. So that our student interpreted an information wrongly and then they reported an incident. They reported a risk incident. One of my students. And when the incident went to the facility manager, they did the investigation, and when the investigation was done, it was deemed as false accusation. And then they were taken out of the work placement. Now they don't have work placement. So, until or unless you have not seen the incident yourself, until or unless you were not there at that position at the same time, we are never going to report, Audrey said this, Young. No. If you were not there, if you have not seen that incident, you're not going to report it. Understood? I'm giving you so many tips, guys. Please keep that in mind when you're in the workplace or you're doing your practicals. Because it's a healthcare environment. It's completely different to what you might have done before. So please take it very seriously. Whatever we are teaching you here is going to help you. Alright? So ask as many questions you can. For some of you, it might be your last class. If you have any questions, ask. Okay? Ask it away. Second thing about reporting, never write reports in past tense. Okay? For example, firstly, the reports should be done in 24 hours. If you have seen an incident, reports are never done 2-3 days later. Incident reports especially, they should be done in 24 hours time. You're not going to do them in the past tense, you're going to do them in the present tense. You're going to say, today this happened at this time, this location, these were the people who were involved, these were the people who got injured or who was affected. It should be in present tense. And the most important one, don't use the lingo that you use to talk to each other. Guys, hi, hello, no. It should be professional. It should be reported. It is a reportable incident. What if this incident is going to my aged care of aged care governance? It should always be done in a way, it should be formal. It should be written in a way that if an authoritative person is reading it, how are they going to comprehend this information? Alright? It does happen like that. People, when they're writing reports, right, they will write, so this happened, like this happened. No. You're writing a report. It should be written firmly. When I say firmly, it's not like, oh, you're holding the paper firmly. No, it should, the language that you use, that you're writing, it should be formal and firm. Stick to the point. Don't write whatever is unnecessary. If the incident happened at 2 o'clock, write 2 o'clock precisely. If you're not sure about the time, just say not in the afternoon or in the evening. Reports are a valuable thing for your client. If your client needs more help, whatever incident reports that you're giving to your facility manager, then only they'll get more help. If you want to help your client, report it. For example, everybody in aged care, they have fundings given to them by our government. Some people have low funding, some people have high funding, depending on the help they need. If you think your client needs more help, they're being aggressive, they have more needs that you alone cannot cater, then you need to do more reporting. Then they will be provided with more help. Understanding?
Yeah.
That's why if you find a job, right, they will tell you again and again, if anything, even small thing happen, report it. Because at the end of the day, your reporting will help your client. Also, don't just keep on reporting unnecessary things. Report something which is factual, not something which is not factual, because they are going to watch cameras. They're going to watch everything. Now, about cameras, by law, there should not be any camera in client's room. Because it's their personal space, there should not be any camera. But because families they live far away from their parents, they put hidden cameras. I'm giving you these tips. So always act like a way that you're being watched by someone. Okay? Families will do that. So even if when they will go to court, right? Let's say you have abused a client, and then because you think, oh, there's no camera in the room. Don't just take it as families can come in and they can put a hidden camera. So you'll be being watched all the time. I'm not scaring you, but I'm just making you aware. Do the right thing. Okay? I don't know if you guys keep an eye on Aged Care News. Let me show you a few videos which will give you a little bit of seriousness of how it can impact your career. There's so many news each day that okay, I'll show you, I won't show you the whole thing because I can't stand it. You'll see me getting angry. So I'll just show you a bit, okay? Keep an eye on these news. It will give you...
It's what Steph expected treatment she received in her final days.
brought us into this world. These are the people that set us up, and they're being treated like this.
So you see, there's no support. There's a camera in them. Because family, because they care about their loved ones, they want to know what's happening. I don't want to watch this further. I don't want you guys to watch it further because it's quite emotional and it just makes me angry why people do this to people in me. So be aware about this. This can happen. Always understand that you are being watched by someone. Okay? Alright? And take it utterly serious that if you do the wrong thing, somebody is going to take an accountability and get you off. Alright? Now, I think we have discussed it earlier. If you do any incident in the workplace, let's say abuse or financial abuse, physical abuse, emotional abuse to a client, the possibilities you will be terminated from the job, and you also will be taken on to court. You will also be sued for the amount of damage you've done, and also you'll be taken out from working in aged care ever again. Okay? Just a reminder. I'm not scaring you, but I'm just letting you know the consequences which can happen. Alright, everybody? Good. Good to know, right?
Yeah.
Yes.
Now about organizational risk, like I've been saying this to you every time, all the organizations have different way they deal with things. So the risk management scheme or risk policies and procedures will be different for any organization you would work with. Now, hazard and risk identification forms. Now, I've given you one hazard form, incident form. You always need to report the hazard to your direct supervisor. Then you need to fill out the hazard form, and then you need to provide details. It should be detailed in a way where this incident happened. Let's say that the person was sitting in a living room. You need to mention the exact position or exact location they were in. They were sitting in a living room on a chair. They were sitting on a chair. Okay? Description of a hazard. They were sitting on a chair in the living room. Accidentally, they fell down because they didn't get a grip of the table or a chair, and they fell down and they injured themselves. Simple as that. Okay? Now, record risk management strategies. Now, why risk management strategies are done? So that we can strengthen staff education. Establish a reporting system. Promote transparency between teams. Also enhance communication. That's why we need to record all the risk management strategies. Okay, now risk management strategies must be recorded in risk register document. For example, sorry. Where are the identified infection hazards are? What was the harm that was caused by the hazard? What is the likelihood that this will happen again? How effective was the current control measure? What are the further control measures required? Now let me explain you with an example. Let's say that person fell down. You have done that incident report. Now the person has fallen down. Now you as an employee and your supervisor, you're all going to sit down and work on the risk management strategy. Okay? Now you have identified the risk or hazard. Now you're going to make a plan. Okay, that person has fallen down. We need to make sure, because she keeps on falling down again and again, we need to give her the walker, which gives her a grip to stand up and sit down. Okay? Now you implemented that. Now you have given that walker to the client. Now you need to understand what is the likelihood that harm can happen again. The likelihood would be 40% now. Okay, because now she has a grip. Now she has something to hold on to every time. Then you need to check for a week or 2 or maybe 3. How is she working with that walker? Is she following it? Is it working? Then you need to make that plan. If it's working, then well, good. If that's working, then you need to see if there are any other control measures that you require to make. If you don't have to make any further measures, all good. The client can keep on using the walking frame. But if there are some measures that you need to change, then you will still have a meeting. You will again have a meeting with your supervisor. Understood? Yeah. Now, always keep a track on whatever risk management process you have made. And now, why? Second, any target training that is required for staff or clients or whosoever is there in the organization. Is there any training required? Then provide a reference for safe work procedures. Ease the reviewing of risk to keep up with changes in relevant laws. Because laws in HK keep on changing. So it gives you it makes your work easy in re-reviewing the risk. Then provide evidence to other people or other stakeholders that WHS risks are being managed in the workplace. That's why we keep track on risk management. Understood, everybody? Am I? And
Yes.
on. Okay. Abby?
Very.
Good. So, if the current time is 2:13, I will run the class until probably 3 o'clock. Do you want to look at the assessments? Yes, no, yes.
Yes.
Everybody happy with looking at the assessment?
Yes, please.
Alrighty.
But we don't have Kristen today.
You don't have what?
We have Kristen.
Oh, do we have Kristen? Kristen,
I don't think so.
why is he not here today? He's been taking a lot more off. That's okay. Who is going to share the screen? Who is good with computer? Yong, are you good with computer?
Yes, I can do that.
Perfect. Okay, give me a couple of minutes. I'll give you control. Before that, I would like to ask if anybody has any question about the unit. Anyone in the classroom would like to ask any question before we move on to the assessment? No? I'll take it as a no then. Alright. Just give me 1 minute long. I need to see. Okay, everybody please open the assessment.
It should take minutes.
How many questions have you got? Is it a lot or very few?
Yeah, I don't think it is a lot. Should be just a few.
Because sometimes, I don't have the whole thing. Sometimes it's just you people have the whole thing. Oh, it's a long one. Is it?
Yes. It's long.
Oh, wow. How many questions have you you got? Well, 45.
Yes, 45 questions.
Can do it. Can we? 45 questions. Okay. Shall we start without wasting time?
Yeah.
Okay. Everybody ready with the assessment?
Yes.
Alright, Young, I'll give you the control. Okay, Young, can you check if you got the control? Just press on share.
Yes. I think I'm just me sure, right?
Huh?
Am I?
We can see that. You don't know the unit? Come on, Young.
This one.
I expect more from you. No, HLTINF 006.
Yeah, the scene that I'm this
So,
one.
yep. Good. We can see two screens. Alright. Alright, everybody, let's start. What's the first question look like? Okay, who's gonna read the questions now? Audrey? Okay. Yep.
Sorry.
I'm going to stop my video because sometimes my video comes in the middle of your screen, right? So just to stop that. Alright. But rest everybody, you're not going to stop your video because I need to see you. Alright, let's start.
Okay. Question number 1. Assess and review national safety and quality health services standards and answer the question. What are the 5 M's of Standard 3? Preventing and controlling infection.
Okay. Anybody got it? Five. So how do you set page 20? Where is page 20? Young, go to page 20.
Yeah. On page 20.
It could be different for everybody.
Page 20 for me.
Page 19.
Yes, page 90. There we go. Alright, everybody? Okay, let's move on to next question.
Question 2. Explain the purpose of each. I forgot this. National Safety and Quality Health Services Standard 3 criteria. So it's going to be the next page, page 20.
Okay.
Question 2. Access and review Australian guidelines and the prevention and control of infection in healthcare 2019. Answer the following question. Explain the aim of the guidelines in relation to infection control and prevention.
Wait. So the second question, is it done? No. Is it done?
Yeah, there's two parts in question 1, page 19 and page 20.
Okay. If it's done, if everybody got it? Anybody, any
Yes.
No? Alright, move on. Sorry, Aldo. I thought you're missing it. My bad. Yep, continue.
No way.
Sorry, my word just stopped functioning.
Question number 3, everybody. What happened?
2.
Are we doing question number 2 yet?
Number 2. Question number 2.
Okay. Alright.
The
you have to-
table is page 20.
Yep. Yes. Clinical governance and infection control. Yep, it's there. Alrighty, let's move to question number 3, please.
Yes. Access and view Australian guidelines and prevention and control of infection in healthcare. Explain the aim of the guidelines in relation to infection control and prevention.
This you have to do it yourself because they have given you the website. So you have to review it and you have to answer accordingly. Okay, everyone?
Yes.
Now, next question, please. Question number 3.
Question 3 is a table. Identify one example of an infectious risk. Describe the harm of the infectious risk. One way you can prevent the harm and one way you can reduce the harm.
Okay. So the first one is human blood. What type of infectious risk can happen due to human blood? Anyone?
Transmitted disease.
Yes, transmitted disease, but what sort of disease are we talking about here? Name that disease. In example, you have to give me the name of the disease.
Ebola.
Sorry?
HIV.
Ebola.
HIV/AIDS.
Yeah, HIV. Human immunodeficiency virus. HIV. Okay?
Yes.
Now, harm the infectious risk may cause.
No.
What harm it may cause?
AIDS.
Yes, good. Good, Hermento. It may, if you don't get your HIV treated, it can progress to AIDS, and it can damage the immune system. All right.
Yes.
Now, how to prevent the harm?
Wear a PPE when in contact with people that are infectious.
That is reduce. That can be used as reduce the harm, but how to prevent the harm? How can you prevent? Anyone else? By using engineering controls.
What's that?
Engineering control, guys. We have just done it. In hierarchy of control. By using engineering controls like retractable needles.
By the way, this table is on page 46.
46.
Yes.
Okay, let's have a look. Young.
Do is what thing. Yes, that one.
Oh, there you go. All right, next question.
Question 4 is another table. Differentiate bacteria and viruses based on each criterion listed below.
Okay. Now tell me, type of infection. No, wait. Differentiate between bacteria and virus. Okay, guys? Just type of infection it causes. Virus, what does it cause? Viral infection. And bacteria causes bacterial infection. Young, can you write it? Oh, there you go. You guys are very fast. She found the table already.
Page 29, guys.
Well done. Next question, everybody. What is
Rất vui được
fungi
gặp bạn. Ngày hôm nay
and everything? You can do it.
It's the same page.
Next question.
Will fungi cause infection?
No, question number 5.
Sorry.
Chain of infection. What is chain of infection, everybody? It's a diagram, right? That shows how infection is transmitted from one source to the host. Okay, that is called chain of infection. Understood, everyone? Question number 5 is what I'm talking about right now.
Yes. Yes.
All good? There you go. Question number 5 is the diagram that illustrates how infection is transmitted from the source to the host. Yep, there you go. Young found it. What I'm talking about. And the diagram is listed on your screen. Everybody, diagram is already listed on your screen. Anyone, any question? Are we going too fast or you guys are okay? Everyone.
Okay.
Only 2 people are okay. Rest, everybody is not okay?
You think they're on it?
Okay. You don't have to write everything, Young. You can just write the page number and they have to do it yourself. Yep. Okay. Question number 6, please.
Answer question about infectious agents. Identify 2 factors that can increase the likelihood of a person getting an infection if they are exposed to an infectious agent. Likely.
What are the 2 factors? Tell me. What are the 2 factors?
Dose,
Come again, Herminto.
infective dose, and availability of the infectious agent.
Good. Well done.
This is page 32, by the way.
You can simply just tell the answer. We don't have to go to pages every time. Herminto, just repeat your question, please.
The answer, do you mean?
Yes.
Oh, infective dose of pathogens
Yep.
and the availability of the infectious agent to infect person.
Good.
What is the relationship between a pathogen's infective dose and its virulence?
Okay. Now tell me.
Yes, that's page 32.
Yep. There you go on the screen, please. Young has it highlighted. Next. Next question.
What is a reservoir of infection?
Yes. Is a habitat in which an infectious agent typically lives, grows, and multiplies. That's a reservoir of infection, where it grows.
Yes. And next question.
Next, please.
Is a table identifying an infectious agent commonly found in the given reservoir, and plan how the identified infectious agent is transmitted to a susceptible host.
There we go. It's just on the same page.
Page 33.
Yep. Got it, everybody?
Yes.
Next, please. What is the portal of exit? The path where infectious agent leaves its host. Yep, there you go. On your screen.
Young, that's an entry one. The exit one is below that page.
Oh,
Thank you.
young. Even I didn't notice that. I just noticed the portal. Exit, please.
And this page.
What
This
is
still entry.
this? Is
It's
entry.
entry, but what I typed was that was exit, isn't it?
Yep.
Here.
Exit is where it leaves the host.
Yeah. So it was correct. Sorry.
All good?
Oh,
Then
good. And then there's a table about identify infectious agent and their portal of entry exit.
okay. Yes.
Which one?
Yep. There, 36. Yep. Young. Okay. All good, everybody?
Yes.
All good?
All good.
Now, next is also a template about contact transmission, droplet, and airborne. All of this we have discussed today in the classroom. So you should remember. Shall we move on?
Yes, another table.
Yep, there you go.
2 type of vectors. For each of the category, provide 1 type of infectious pathogen transmitted by the identified vector, the disease associated with it, and how it transmits.
Perfect. Now, animals. Okay, found it. Please check the screen.
It's on page 40.
All good, everybody?
Good.
Next.
Indirect means of transmission of infection. Provide 1 example of how infection can happen.
Okay, now we are not going to look at the learning table. We are going to discuss this in your own words. Now, surface contamination. Give me an example. Come on, everyone.
Surface contamination. Touching the door.
It's like temple, right?
Sorry?
Oh, never mind.
No, I can't hear
They're
you.
getting itchy.
What?
They're getting itchiness.
No, surface contamination. Surface. We're talking about surface.
Touching a door.
Table or door? No.
Yep, touching an unclean, touching like a surface like a table or a door with your dirty hands or unclean hands. What else?
Like you sneeze into your hands and then touch other things.
Yes, that is also surface contamination. Good one. What is object contamination, everybody? Come on, give me.
Is that
Yep.
giving glass some water and then hand is dirty, you give it maybe a spoon or something.
True. That's good. Or maybe
Share
the
power.
equipment like your mobile phone or your laptop, you're touching it, and if like a person who is having COVID or fever, if they touch your laptop, or they touch your things, and it can get infected. Okay? Penetrating injuries. Penetrating injuries, guys?
Recording in
Now,
progress.
Next, please, susceptible host.
Susceptible host.
Is a person who is at risk of developing an infection from infectious agent. What happened?
I forgot the.
With at risk of developing
With
an
risk
infection.
of developing an infection from infectious agent. Okay, next question, please.
Explain how each factors listed below can affect a person's susceptibility to infection. Susceptibility.
Wounds. How does it affect a person's susceptibility to infection? Yep, you're correct. Wounds. Yep, this page. 42. Alright, move on. Next, please. We have only 20 minutes left for the class to end. So I'm trying to make sure that we discuss most of it. Now, identify 2 general ways that can help reduce the transmission of infectious disease to susceptible individual. How can you reduce the transmission?
Continue this infection.
Huh?
Regularly disinfection the surfaces.
Come again?
Like regularly disinfect all the surface.
Next question. Answer the following questions about personal hygiene practices. Now, tell me 5 examples of personal care practices for maintaining good personal hygiene. You guys tell me. Don't see on a learner guide. You should know what are good hand hygiene practices.
Wash hand,
Yep.
wear gloves, sneeze and at the elbow, and then push, not using hand to open door, just use his elbow.
What was the last one? Say again.
Open door by using elbow.
I mean, yes, you're right. Wash hands when you're handling food. Wash hands before eating. Wash hands after using garbage. Taking bath every day. Normal things. Trimming nails regularly. Taking care of yourself. All that. Alright, everyone?
Yeah.
Next, please. Explain how keeping the workplace cleanliness contributes to personal cleanliness. It's very important that if we keep ourselves clean, we should also keep our surrounding clean as well, especially where we work. Correct? If everybody keeps their workplace surrounding clean, it means that they are practicing personal cleanliness. So basically, just write in your own words. What does it mean to you? Young, you don't have to write. It's okay. They can write it themselves. It's a very common question. Now, the part 3, please. List 3 ways you can contribute to workplace cleanliness. How can you contribute to workplace cleanliness, everybody?
Empty the garbage recently.
Empty the garbage. What was the last thing you said?
Recently.
Empty the garbage frequently.
Oh yeah, frequently. Sorry.
And then clean up after you use anything.
Yeah, clean up after yourself.
Yep. What else?
Clean up if you see anything that's not right. Like if you see a mess, clean it, not leave it.
Yep. Don't leave the mess or dispose. Or no, I think disinfecting the things that you use.
Disinfect all the surfaces.
Disinfect the frequent use places. Okay. Next, explain why it is important that you don't attend work when you're ill. You all know this?
Not to transmit your illness to other people.
So that you don't spread illness in the workplace. Easy?
Yeah.
To stop spreading the workplace, spreading infection in the workplace. All good? Next question, please. Yes, Audrey.
7 steps respiratory hygiene and cosmetic, as mentioned in the guideline Australian for prevention and control of infection in healthcare.
So you can go on to that website given over there, right? You can click on it and you can review. Now next. Sorry, Audrey.
Why must you cover your mouth and nose when coughing or sneezing?
Yep. You guys tell me why you should cover your nose. You need to prevent the infection of spreading into the air and spreading illness. Okay. Note up. Next, please.
What must you do after sneezing, coughing, or using tissues to prevent the spread of infection?
Okay, you tell me.
Dispose of the tissues, wash your hand or use hand sanitizer.
Yep, good. What else?
Identify 4 general laundry management practice for contaminated workflows.
Okay, yes, I told you this. What you should be doing, the first thing should be when you're handling workloads?
Separate them.
No, first thing.
Wear gloves.
Wear gloves, well done. Wear gloves. Second,
Separately. Use bleach.
what else? What else?
Use hot water.
Yep, use hot water when you are washing the contaminated clothes. And also don't separate the contaminated clothes from others' clothes. Third,
Use a chemical or use a chemical to wash the laundry.
what else?
Dry the clothes.
Come again?
Dry the clothes.
Store work clothes and also store work clothes separately from your own private clothes. Alrighty? Alright, everyone? Next question, please.
Identify 3 measures you must take when washing clothes to minimize the risk of contamination or spread of infectious disease.
Okay, you guys can do this yourself. Next. It's all about clothing. What's the page number, Armento?
Red?
Armento?
Yes, correct.
Page number for laundry?
80.
80. Okay, everyone. Refer to page number 80. Now, let's move on to question number 14, please.
List the 6 steps of hand washing in their correct order.
Okay. Hand washing. What is the order?
Left hand.
It should be page 94, but I just found 5. It's not 6.
What? Sorry.
It's page 94, but I just found 5. It's not 6. 94.
Yeah, 6. 6 one would be, dry your hands with using clean towel.
Because
Okay.
dry is number 5, I don't know what.
So let's stay for. Wait.
There is a step 1 with your hands, and then it's just 5.
Number 6 might be pray.
Okay, one thing that we have missed here for number 4 would be scrub your hands for at least 20 seconds. Or scrub your hands for at least 20 seconds. Please include that. All good?
Yes.
Next.
Answer the following question about hand care. 5 important considerations for hand washing. That part in the middle. Like palm to palm and like back of palm.
5 considerations. be below your
95.
Yep.
Page 90.
below the
Page 95.
Yep, there you go. Yes. Good. Next, please.
5 ways to take care of your fingernails.
Page 88. Yes.
Why is it important to maintain intact skin? Page 86. Yeah, 86. And 3 ways that help maintain intact skin. That one is also page 86. Yeah, intact skin is a first-line defense mechanism. Something.
You guys are running too fast. You're on page 17. On question number 17.
16.
Okay.
Identify 5 instances when hand hygiene must be performed to prevent and control infection based on Australian guideline for prevention and control infection in healthcare. 5 instances.
It's given over there, so you can do it yourself. Okay?
Yes.
Now, 17, please. 7 steps for alcohol-based hand rubbing. It should be near 95, 96. Yep, there you go. Scroll a bit down. Yep. Yep. These are the steps. Good.
Following step. 96. What is the recommendation alcohol concentration for hand rubbing?
Mm-hmm.
I remember 60 to 86 concentration.
60%.
60 to 80.
6.
At least 60%.
Less than 95?
Yeah.
No, we don't use 95.
No, I mean more than 60 and less than 95.
Yep. Good. Okay. Next, please.
What is the difference between using soap and water versus alcohol-based hand rub when used for hand hygiene?
So, what is the difference between soap and water?
That's on page 92 until 93.
Let me give you a basic one. Soap and water should be used when your hands are visibly dirty. So, for example, you have eaten something greasy and you have a lot of oil or spices on your hands, then you should be using your soap and water. But sanitizers like alcohol-based rubs can only be effective when you are using any kind of germs, any kind of, like, for example, you're touching something or you have touched something before and you want to just kill germs. It's only used then. But soap and water can remove germs which are visibly dirty. Okay? So that's the basic difference. Next, what are 4 instances where soap and water are recommended? When before eating food, after eating food, after using a toilet, after touching a garbage can, if your hands are visibly dirty or greasy. Okay?
2 instances when alcohol base is recommended for hand hygiene.
Before and after visiting anyone in the hospital or nursing home. Also when soap and water is not available.
What must be done with arm, hand, jewelry, and watches when performing hand hygiene?
It should be removed. Okay. This is 20th is the last one that we will do, and then you guys are gonna get break before the next class. Okay?
Yes, that's 2 hand hygiene precautions to be followed when there are breaks in the skin and when the skin conditions present.
Yep.
Skin conditions present is like eczema.
Yes, eczema. Yep. So, everybody, tell me.
Breaks. Wear gloves.
Sorry, come again.
Use gloves.
How many you use glove and wash?
Yeah, consider wearing gloves to protect skin. If your skin is like, if you have wound on your skin, make sure you use gloves. And use a barrier cream or lotion to keep your skin healthy.
Wash hands.
Come again, Leo? What?
Wash hands.
No. Wear gloves. And for the second part, what's for the second part?
When there are skin conditions present, what are the precautions for hygiene?
Do not overly dry your hands. What else?
Use specified soap.
Yep. Use specified soap or cream to keep your hands healthy. Alright, everyone? Yay! Good! Well done, everybody. Well done for today.
You too.
Me too. Thank you. Good to know. Okay, everybody, you've done a good job. Do you have any question for me? Thanks, Young. Thank you very much. Thank you very much, Audrey, for your help, guys. So, Young, you can like stop sharing. It's all good. Rest, everybody can do it themselves. We have done half of the questions. So you can stop sharing your screen. Good. Held. Alright, everybody, any questions for me?
No.
No questions? Okay. You guys can have your little break and then I'll see you 5:30.
You 5:30.
Okay, take care.
See you later.
See you later, everyone. Yes, Mariati?
Yes, I think I missed the what's called
Roll
the absent.
Yeah, why did you miss it? Come on.
Yeah, because I was working. I'm sorry about that. In the morning. That's why I miss it.
Oh, good. Okay. Mariadi. Did anybody else miss? Didn't miss?
Okay.
Mariadi? Yep, Mariadi, I've given you the roll call. Anyone else who missed?
I think I'm me and so
Sharon, what's your full name?
Sharon Presna Paramita.
Have you just joined the class today?
Yeah.
Oh, okay. So you're not in my list. Could you please write your full name in the chat box?
Alright.
It's your first day today?
Yeah.
Oh, welcome. I didn't know. So could you tell me your first name? Hayes. Sheren.
I put my name in chat. Yes.
Perfect. Okay, good. Welcome to the class then. Did you enjoy it today?
Yeah, of course.
Sorry?
I enjoyed it.
Good. Alright, anyone? Any other questions? I've given you the attendance, Sharon. All good.
Yeah, thank you, Miss.
All good. Anyone, any other questions for today? Or shall we leave to see each other on 5:30? Okay, take care, everyone.
Okay, thank you.
Thank you so much.
I see you.
See you all. See you guys. Bye.
Thank you. See you.
See you.
Recording stop.